If you've recently been admitted to the hospital, chances are you weren't seen by your primary care doctor. You likely had what's called a hospitalist overseeing your care. So, what is a hospitalist and what's their role in helping you get better? Find out next on Being Well.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you so much for joining us today for Being Well. Now, you might notice the format looks just a little bit different. That's because our guest, Andrew Mahtani, who's a hospitalist, has been serving farther away than Central Illinois. Welcome to the show. Thanks for joining us.
Hey, thanks for having me.
So, hospitalist, first off, what is that? A lot of folks maybe haven't heard of that. Maybe they've just heard of a primary care physician.
That's right. Yeah, it's a good question. So to preface it, I've actually worked in primary care for several years, and I transitioned into hospital medicine because I enjoy the acute care spectrum. I enjoy working closer with patients in real time. And hospital medicine has really grown out of the challenge that we found in primary care of being in two places at once. I worked in 4 cities, and I had hospitals that I covered myself, but then with people traveling as much as they do, I had a lot of patients in other hospitals, and I just couldn't see all of them in the hospital. And it was for those programs that I was grateful to have a provider that could help manage these patients. And what I found and what I've seen in training was that when you're in the hospital, you're able to focus purely on that patient that's in front of you, and you don't have to juggle things in the clinic that are time sensitive, and then also in other areas. So hospital medicine is actually one of the fastest growing specialties in the country, where again, the focus is on clinical excellence for very sick patients with pneumonia and heart failure and COPD when they're at their sickest. So that's where minutes count. And what we are able to do is to deliver that timely care and really act as a support and a bridge for the primary care docs that are also, we're essentially part of the team when patients are at their sickest.
And so you are kind of, like you said, that bridge, because a lot of folks, when they are in dire need, whether they go to the ER or are admitted, they might ask, can I see my doctor, or things like that, just because they have a more comprehensive understanding of their medical history. Is that right?
Sure, that's right. That's right. That was one of the things that I was most concerned of going into hospital medicine. I mean, I knew my patients like the back of my hand. What is interesting is the more you do this, the more time you spend in the hospital, the more you get to know these patients and these primaries, where we're truly a team. And when you function well together, we've seen improvements in those acute conditions, and we've helped, to bring down those numbers in terms of the number of times the patients go back into the hospital and have those recurrences of COPD and heart failure, and can help manage those in a timely manner. In addition, with us having 24/7 coverage, it allows our primaries to remain fresh and vibrant in the office, where they're more apt to pick up on these cues when they hear the issues that patients are having, and they're more apt to be able to provide that good quality care when they're well rested. So it's been a life changer for me. I mean, we have 3 kids, and I was trying to juggle a very busy practice. I had 2 offices. I was overseeing nursing homes. I was doing home visits, and I loved the work. I loved the relationships that I had with those patients. But when you see these patients in the hospital on different occasions, you get to know them in the same way. So you get to know them, their family, and you get to join in that special place of healthcare.
Definitely. Is there any difference in education between what a primary care doctor would get or a hospitalist?
Yeah, so it's a very different population. Most programs give you training inside and outside of the hospital. So you have 2 routes typically. You have internal medicine or family medicine, and the backbone is essentially the same. But the difference with hospital medicine versus primary care is the breadth of diseases and of the population that you're treating. In primary care, you're looking at prevention, you're looking at acute management, you're looking at chronic disease management. In the hospital, the focus is generally for the acute care where seconds and minutes count. And in primary care, you're juggling all of that. And it's a very interesting and a very challenging field to be in. And in hospital medicine, it's just a different flavor, essentially, where you're dealing with more of those acute patients, where you're trying to make these diagnoses in a timely manner, which is easier when you have that luxury of time and you're able to be in there full time, as opposed to having to go from one place to the next. So the training essentially is similar, but it depends on what your focus is. So a lot of people will focus more on the primary care and on the outpatient setting. And for me, it was something I enjoyed all of it. And what I find now is I have a far better life balance, where I'm able to go home and spend time with the family instead of always being on the clock and ever available.
Which I'm sure is super important in this field, because I'm sure a lot of medical professionals deal with that burnout day in and day out.
Yeah, that's a good point. Yeah, it's definitely been a big improvement in quality of life. My partners and friends that have transitioned from bridging both primary care and the hospital have had a marked improvement in their quality of life. They look younger. On the other hand, it's a beautiful thing to be able to take care of your patients comprehensively. And I admire those providers that do it, and I miss it. I enjoyed it. It was a lot of fun. It's just it was a big challenge for my family, and I feel like looking back, it was the right decision.
And so you said this is kind of a newer field, correct, or newer position?
Yeah. It's the fastest growing specialty, and it is. The reason it's growing so fast is because the quality there's so much potential. So with one having to go from the outpatient setting to the inpatient setting and back and forth, it really allows you to take a microscope or take a magnifying glass and look at the entire process of that care in the hospital. But then also outside of the hospital, because it's in the transitions of care where most of the problems arise. So it allows us to attend and really become ingrained in the hospital system and help improve those processes of testing, of workups, and the quality of testing that we're doing. But then also be there. So if there's an acute change in the patient's status, we're right there at the bedside, and we're able to make those interventions that could be life that could be life-saving. So it's truly an interesting, truly an exciting field where you are making these day-to-day life-saving changes and getting to know those nurses and those teams very closely. And because it's, the work that we do is a very small part of what actually is happening to that patient. It includes the nurses, it includes the radiology techs, it includes the aides, it includes the housekeepers, it includes all of this to help reduce hospital infections, to help improve quality and patient outcomes. The big things that we're looking at are when the patient leaves the hospital, how is that information communicated effectively to the primary, and how are we taking part in that? Some primaries prefer to be called, some primaries prefer to have messages sent, some just prefer the charts, and it's in fostering and developing those relationships that really impacts patient care, not just with our colleagues, but all of the entire team that's involved in patient care, also with the case managers and social workers and pastoral care and the administration, making sure that the whole engine of the hospital system is moving and functioning.
You're one very important part in that well-oiled machine.
Right. Yeah, we're all incredibly important. Every single person takes such an important role. And every time I see my team, the aides, the nurses, one thing that we do that I enjoy very much is our huddles together, where we sit together with the entire team, and where we have our case managers, social workers, where we have the nurse of the patient, where we have the head nurse of the floor, and therapy, dietary, and we all sit together and we go through every single patient that we're caring for. And everyone is able to weigh in and give their concerns, and we're able to deal with that, in a cohesive manner. And then before the patients leave, we also make sure that we sit down as a team and we meet with that patient at the bedside, and we make sure we allay their concerns. We make sure that that they understand what is going on, because in medicine, for us, it's our daily work. That our training is for different people. Doctors typically have 10 years of training under them that they're utilizing, and a lot of times when we speak, it's very difficult for people to understand what exactly happened. And even one example is my father, when he had his heart attack, I had no clue what was going on. And I had a good relationship with the cardiologist. I'm a hospitalist. I've been doing this for over 10 years after training, and we have it was so interesting where the nurses were great, everyone was incredible, but the communication was not in sync. And if I as a hospitalist don't understand what's going on with my dad with his heart attack, that's a great example as to how others don't understand. And for me, health literacy is an interesting topic, because the majority of people, when they talk to their doctor and their healthcare team, they only pick up about 10-20% of what we're telling them. So it's very important for us to make sure that we reinforce and the patient understands what's going on. It's very important that we have that good working relationship and we build that rapport, because otherwise they're not going to take our recommendations. So there's so many different factors you have to take into account, and for me it's fascinating.
I tell you what, I had my first hospital stay earlier this year, and I had a hospitalist, but I had no idea what that role was. And so when they said the hospitalist will be around soon, I was like, what is that? But after he was able to get that one-on-one attention, that's when it kind of clicked, like, oh, he's dialed in for this.
Mm-hmm. Mm-hmm. Yeah. For a lot of people, there's confusion. I mean, the whole thing, you know, it's the worst day of your life. No one wants to be in the hospital. You don't know whether, you know, what degree of severity this illness is. Is it something that's short term? Is it something that's long term? How is it going to affect my family and my life and my livelihood? You know, for people that have dependents or people that have no one to rely on. I mean, there are just so many different things, and that's what for me is so fascinating. You know, anyone can treat pneumonia, but not everyone can treat the patient. And I think that's the key with any physician. You know, how can you zero in and connect with that person? I loved working in primary care. And as you had mentioned, it was taxing. And now I find it really helps to balance that workload and really help out our colleagues that have such an important role in providing that preventative medicine, that chronic disease care and that acute care all in one. But allow them to do that in a timely manner, to be able to see more of their patients and to get them in a timely manner.
Definitely. So I want to touch a little bit on why we're doing a Zoom meeting. We're taping this in June. And can you kind of share what your role has been kind of in the last, couple of weeks?
Sure, yeah. So hospital medicine is focused on that acute care spectrum. So I'm the regional director of our group. We cover a territory or a region within the St. Louis, greater St. Louis area. In the last few weeks, though, our group was approached by New York to help with the disaster relief. And I spent time in a COVID hospital in Brooklyn, in Woodhull, a teaching program. And we have a former partner that is now working as a program director there. And those doctors have been fried. They were completely burned out. A lot of them just left. A lot of the residents, so every doctor has to go through a residency program that typically is anywhere from 3 to 7 years. And even residents that were at the end of their training were considering quitting. They said, this is not for me. I can't handle this. You know, we've seen doctors that have committed suicide. We've seen doctors that just had breakdowns, that got sick. The program director, he got sick, definitely sick, and a lot of the residents did as well. They were dealing with limited protective equipment, and everyone was just in a state of shock, and right now are in a state of post-traumatic stress disorder. So they called us up, and within days we were able to amass a team that could help in New York. And I was one of the first that was able to go over, and it was a humbling experience because what we've seen of COVID here was nothing. What they've dealt with was by far worse than anything I've ever imagined. And they're still dealing with the fallout of that, and they're terrified of a potential second wave. So my job as a regional director is to help to coordinate physicians and support within the hospitals that we partner with. And this was one example of what we can do when we're part of a larger team, and when we have providers that are supportive and that that believe in what we do and that went into it to help. So yeah, I boarded a flight that was half empty, and there were more people than I expected. And then yeah, the streets were not the streets of New York I remembered. So everything was shut down, everything was boarded up. And what stays with me, what I remember most, is the look on those masked faces. The eyes were tired, and the walks were slow. The step was slow. The gait was slow. People, and they were they were run down. they're incredibly supportive or grateful for the help that we're giving. And it was a wonderful experience to be able to go and help our colleagues that are really struggling right now. So it was a humbling experience. But yes, so that was just a small part of what we do and where we can help other areas. So the state of New York was under an emergency status, and they were able to really move through those credentials in a timely, real fast manner. So within days, I was on a plane and helping out.
Sure. And one of the other things that we wanted to hit today was barriers to care, and whether it's during a COVID-19 climate or just run-of-the-mill climate, there's a lot of things that folks maybe have trouble with when it comes to care. Can you talk about some of those barriers?
Absolutely. Thank you for asking. That's a passion of mine. For every disease, you have a spectrum. So when you're a diabetic, you could be at the beginning of that spectrum, or you could be at the end of that spectrum. And usually we catch these diseases somewhere in the middle, or somewhere, depending on how quickly you get access to care, how quickly you can get that problem dealt with. So what we're seeing right now in COVID is the patients are terrified of coming to the hospital. They're afraid of COVID and of dying or passing it on to a loved one. So we're seeing a spike in deaths at home. So now we're seeing the other spectrum. At first we're seeing patients that are coming into the emergency room for every nick and every scrape, and then we're seeing patients that are not coming when they have heart attacks and strokes. So that's where it's very important to make sure you're connected with your primary, that you're connected with your loved ones, and that you have that support at home. So one of the biggest barriers we're seeing is that fear, because of all the media attention and everything on COVID, that's where you're going to get infected in the hospital. Well, the hospitals actually are doing an incredible job in mitigating that risk. We're practicing social distancing. They're separating patients, keeping them in different areas in the waiting room, really trying to get them out of the waiting room and into a room as soon as possible, and an appropriately cleaned room as well. So we're actually seeing that opposite end. So the number of patients in the emergency room have dropped dramatically, whereas the number of deaths at home have more than doubled. So we're seeing this disproportionate number of patients that are not coming in when they're having chest pain, when they're having trouble breathing, when they're having stroke-like symptoms such as weakness on one side of the face, or a change in their speech, or a weakness in one part of their body. So that's, I think, one of the biggest barriers is that fear that we're seeing now. Other barriers are just getting into the primary, and that's where knowing that you can connect with your primary and talk to your primary, whereas we're trying to stem this, the risk of spread. A lot of them are practicing just telephone consults and even virtual consults at home. So making sure that you're plugged into your healthcare team, and if you don't have a primary, that's another big barrier. So a lot of people are having trouble just getting a doctor that they can connect with. And that's where connecting with your hospital with the hospital in your region can be very helpful to make sure you're getting the appropriate information to connect with a doctor or an advanced practitioner that can help.
And then also, if you have it available, a family support system can be invaluable.
Yeah, there's a lot of studies that show that the key to longevity is your social support system. It's not necessarily the best vitamin or drug out there. It's actually your network, and they've done a lot of studies looking at personalities, looking at genetics, looking at food, And all of that's important and all of that plays a role. But the big differentiator is actually having 3 or more people that one is closely connected with, that they can rely on at any time. But that's also connected with them, that they can talk to, that they can grieve with, that they can that can pick up on things. So yeah, that's where having a spouse, men tend to live longer when they're married, and people tend to live longer when they have more people around them that can help them and make sure that that they have what they need, that if they're not heard from, for an evening, that someone's checking in on them. Even, and there are other things that can help, like a life alert system, and if, for example, when people fall at home, if they have no support or if they have no one around them and they break a hip and they can't get to the phone, they can be on the ground for an extended period of time in a lot of pain. And it can be very difficult for them to find a phone to be able to call for help. And some of them just don't have the strength for even that. So it's things like that too that can be very helpful.
Well, Dr. Mahtani, I thank you so much for your time today. That's all the time that we've got. And thank you so much for joining us, for being well, and we'll see you next time.
Thank you, Lacey.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.